Alright guys, welcome to episode 146. Today we're talking about ADHD and the possibility of drug-induced psychosis. It was a topic that was requested from the mental health team with the York Regional Police, and I appreciate that. So, tribute to you. Drug-induced psychosis, by definition, is a form of psychosis brought on by alcohol or other drug use. It can also occur when a person is withdrawing from alcohol or drugs or medications or whatever. The most common symptoms include visual hallucination, disorientation, and memory issues. So what does drug-induced psychosis feels like? Drug-induced psychosis happens when you experience episodes of psychosis, such as delusion or hallucination, as a direct result of substance abuse, or I think that's very biased, but this can be either worsen or trigger the onset of mental illnesses such as bipolar, schizophrenia, which can be characterized by symptoms of psychosis. I don't really agree with that either, but I'm not a doctor. And this is just my research. How do you treat substance-induced psychosis? Treatment in most substance-induced psychosis, stopping the substance and taking an anti-anxiety or antipsychotic medication is effective. For psychosis due to drug use, such as LSD, which I didn't know, quiet observance may be all that is needed. I didn't know that. I don't do drugs. I don't do psychedelics, so I don't know. What drugs are most likely to trigger psychosis? This is the reason why I put it in as ADHD episode. It's because methamphetamine, which I call baby meth, okay? I know that sounds really funny. People have different names for it and stuff like that, when they can get Ritalin on the streets. I'm definitely, obviously, properly prescribed and tested for ADHD, and that is what I support. So, essentially, methamphetamine is, or methamphetamine, they belong in similar classes, right? Also, the meth, they're synthetic, and with meth, like a regular meth, not methamphetamine, if you take it for too long, or even if you're on it just once, sometimes you can trigger the psychosis that people feels, or have the delusions and stuff like that, especially when you're withdrawing from the medication, or from the drug, not medication. I know this because I did it when I was young. When I was in last year of my high school, I was 16, 17, and I did it only 3-4 times. And I said, you know what? No, I'm going to go see a psychiatrist, and because I like it so much, it's going to ruin my life if I keep liking it. Like, I study on it. I read the whole entire Kung Fu novel series on it. 金庸小说4-6本全部都读完了。in like 4 hours. And I started burning out because my friend was, my tolerance is double the strength as other people. But anyways, okay, I'm going to keep on. How to deal with someone in drug-induced psychosis? Well, like I said, I already said that. What can be mistaken for psychosis? This is really important. Some brain tumors may cause psychotic symptoms that seem like schizophrenia. Likewise, people who have had a traumatic brain injury or even traumatic experience may have symptoms such as psychosis. Doctors often use tests like CT scan to figure out whether a person has a brain tumor or brain injury as opposed to a mental illness like schizophrenia. While psychosis often requires professional treatment, including medication and therapy, certain natural approaches can support recovery and management, such as CBT. I support CBT, I do. This includes maintaining a healthy lifestyle, managing stress, practicing mindfulness, and building a strong support system. It's crucial to remember that these approaches should be used in conjunction with, not instead of, professional help. Take care.